Headache is something which all of you might have experienced, but migraine is different. Many people just loosely interchange the names and say they have migraine. Actually, migraine is just one type of headache. The International Classification of Headache Disorders shows more than 100 type of headaches. Studies say about 20% of people would have experienced migraine type of headache in some point of their lifetime. So now in this migraine, there is a severe form called chronic migraine. Patients with chronic migraine experience migraine attacks of more than 15 days in a month for more than 3 months consecutively. These attacks may last from 4 hours to even more than a day. Patients usually say they are not able to look at bright screens or listen to loud sounds. Sudden change in the climate or sudden change in mood like becoming angry can trigger a migraine attack. They'll be leading an unimaginable and intensely restricted kind of life, which may even affect them psychologically. Treatment of migraine initially is done with common painkillers and sometimes with special painkillers which are made for migraine type headaches. When none of this work, the treatment aims at preventing migraine attacks. There are no preventive measures for migraine except for one method that is been showing good results in the studies conducted in recent past, and it is approved for treatment of chronic migraine also, and the name of the medication is Botox.
Now, after knowing what migraine is, I will be discussing about the use of Botox in the treatment of migraine. Botox is botulinum toxin, which is a chemical that has been approved for the treatment of chronic migraine. Botox should basically be used only in patients who have failed to show response to medical treatment, with failure of at least 3 prophylactic medicines. Now, how Botox acts in migraine? It acts by inhibiting the release of pain mediators like the substance P, glutamate, calcitonin gene related peptide from the nerve endings, and thus helps in reducing the pain. It is important to remember that Botox is not a cure for migraine. It only helps in reducing the frequency of migraine headaches per month, in reducing the severity of the pain, and thereby reducing the disability which is associated with migraine. Now, there is a specific protocol that is being followed for the treatment of chronic migraine. Based on this protocol, a total of 155 units of Botox are injected at 31 different sites, which involve 7 muscles of the head and neck region. The interval between 2 treatments is usually about 12 weeks. The muscles where the Botox is injected involves anteriorly the procerus corrugator, the frontalis, laterally temporalis, and posteriorly occipitalis, cervical paraspinalis, and trapezius.
Botulinum toxin injections for migraine headaches. What is the dosage and where are they given? Dose for each site injection is 5 units of botulinum toxin, that is 0.1 ml, and they are given in the muscles of head and neck, namely the procerus, the corrugator, frontalis, temporalis, occipitalis, spinal paracervical, and the trapezius. The injections are split into 31 different sites with different specific sites in each muscle. After first sitting, second sitting is given after 12 weeks, and then the patient is assessed for progress. If there is response to the treatment, further treatment is continued with successive injection sessions every 12 weeks to alleviate migraine headaches. So if the patient already has muscular dystrophy disorders, then worsening of symptoms such as dysphagia, etc. should be monitored when using botulinum toxin for migraine headache. And another adverse effect that needs to be monitored is specific allergic reaction that can happen to botulinum toxin itself.